The SLU nurse is a very unique nurse in that they are, being in an academic setting, they are excellent clinicians. They really know not only how to take care of their patient, but what's going on with their patient.
And so I work in several different units, and so I know that if I take my patient post-op, no matter what their challenge may have been during surgery, and put them in a certain unit, I know what I'm going to get because I have a huge trust in that. And so that's why I bring my hardest cases to St. Louis University Hospital.
I think the nurses here are special because what I like to tell people in the outside community is we do sick. We know how to do emergent. It's not something out of the ordinary for us. It's what we do on a daily basis. We do it well. It's part of the routine. And if I have something that's really going wrong with the patient, there's nowhere I'd rather be in order to provide the care.
For me, it's spiritual, also being religious. I feel that I'm more connected with them. To be empathetic, to be compassionate. What moves me the most is when I have a patient and when I have that one-to-one spiritual talk, and when that patient really opens up and I connect with them one-on-one. He was diagnosed with a very severe disease. He didn't really open up to his wife, but after she left, he was just overwhelmed with just emotions, and I was able to sit next to him and just be there, not really say too much, but just agreeing with them. And just having him vent was just really rewarding for me. He was crying, I was crying. He thanked me afterwards, and that was very rewarding.
I think we go home feeling accomplished. I think a lot of times when you go home from work, you're not sure what you've done during the day. Here we know we've saved lives, we've made a difference. They cut out articles from the newspaper about patients who've been here. They see stories on the news and they're proud of it. A really sick patient arrives in a helicopter and the staff all work together and get them in and get them settled and take care of the family at the same time. And the next morning when I come back, everyone's calm and the patient's stable. So the day before is a very good day for me. I don't feel like a boss. I feel like just a leader in a crowd, in a group. I'm the person who may do it first, so it was important that they recognized me and that they appreciate me. That meant so much to me, to know that I was appreciated by the staff.
I help accomplish the mission of this hospital. I am a firm believer in the mission of this hospital for the glory of God and the health of these people. And every day I come to work, I make sure that I take care of the patients, help them go back to the peak of their health. When I was hired here in SLU 10 years ago, my recruiter told me, if you make it in SLU, you'll make it anywhere. I like it. I will not say I like it, I love it. I love being a nurse. And as I have said, I cannot see myself doing anything else but nursing.
I love adrenaline. I'm crazy about adrenaline. We are usually pretty assertive. I'm sure there's a couple of other people who would call it another word, aggressive, but I prefer assertive, and I think a SLU nurse, like I said, doesn't like to sit down, doesn't, loves to be on the cutting edge of research, loves to get in there and pull their sleeves up and really get busy. We get a lot of doctors who are very uncomfortable, and I remember one time the doctor was trying to find, VTAC and what to do and everything in the book, and I said, you know what, we're past the book. You gotta put the book down, we'll get through this together. And I think that many times I tell new nurses, it's okay to die. That's normal. Dying is okay. So we try to make sure they have their dignity, and I try to add the component of, well, we need to call the family.
And you come to work and you're expected to do a good job, and you know that your peers like you, but never to the extent that, they write recommendations and you're part of a team, but the personal and the recognition of an award like this is more than I ever expected. I've seen doctors do some things here that has actually been unbelievable. I've seen people massage a heart, go into a belly and massage a heart and bring somebody back that we never thought was going to make it. I've seen Dr. Witkins do some work, some vascular work. It's like knitting almost.
She's truly one of the most special people in my life.
I kind of trained her. She started here as a resident, and she was spicy. It's just something about some of the doctors, even some of the females, even a difference between the female doctors and the male doctors. And she was just had her, knew what she wanted to do and where she was going, and her power and her energy level. It's just something that just attracts you. And so we became pretty much friends. When I knew she was working as a resident, I wanted to be a part of that case.
It's one of those things that makes me very emotional. And what she knows, and I hope she knows, is that she's one of the most special people in my life. And I can't imagine coming here without seeing her every day and having her presence to help me care for these patients.
She'll come in and my table can be a mess. She never says a word because she knows that I've got everything in order as to what she needs.
I started in a 4-bed ICU where we had no central monitors. We had a central printout machine that was called the Johnny Walker machine. Not Johnny Walker Red, but a Johnny Walker made by Johnny Walker Electronics, and this person built it in his basement. The hospital was not air conditioned, but it's the cutting edge. I took care of the first heart transplant in the city back in 1972. I feel I have been challenged and asked to push the envelope, and I've seen other people come back and say, this doesn't match the place that I went to. And it's just, the grass isn't really greener. This really is a cool place to work.
I'd like to tell them thanks for all the wonderful care they provide for my patients. Thanks for the smiles, and continue to do a great job.
I don't think everyone always gets the chance to express to these nurses how important they are to us.